in this horrendous violence. I also wish a speedy recovery to the many people who were wounded. The bombings have shown yet again they have appointed the African Union High-Level Panel as facilitator. The United Nations will continue to work closely with both parties, as well as with the African Union and regional stakeholders to support efforts to promote a timely and credible process. We are very concerned by the deterioration of the security situation in Darfur. We will continue to support the Joint Chief Mediator's efforts to bring the Justice and Equality Movement and the Sudan Liberation Army Al-Wahid faction to the negotiating table with a view to arriving at a comprehensive peace agreement. Excellencies, let me turn now to the theme of this summit, maternal and child health. I commend your choice, and not just because I'm a woman. The evidence is clear. Women and children are the engines that drive our families and our communities, our economies and our nations. Investing in women pays. It is one of the best investments we can make for these and future generations. But I also welcome your focus on women because of the message you are sending. Ladies and gentlemen, time and again, we have seen that progress demands leadership. Leaders who devote themselves utterly to a challenge, who make it a daily touchstone, a constant subject of meetings, a prominent part of their budget outlays, a matter by which their ministers will be judged.
I'm really serious.
When leaders do this, on AIDS, on climate, on many other issues, when leaders are engaged and hands-on, good things happen. So it is good and right that Africa's leaders should make maternal and child health a head of state concern.
Try as much as you can go there. Can you take one for me?
Progress on maternal and child health in Africa has been lagging. Achieving the relevant MDGs by the agreed deadline of 2015 is going to be difficult, especially for those countries that also face malnutrition and the HIV pandemic. Excellencies, we must build on the work Africa has already done. The Maputo Plan for Sexual and Reproductive Health, the Karma Campaign for Accelerated Reduction of Maternal Mortality in Africa, and the Abuja Call for Accelerated Action towards universal access to HIV and AIDS, TB, and malaria services. We need to bring people together on what can be sensitive issues. The African Union has also taken the very commendable step of promoting dialogue among religious leaders. Just as we need to work across the lines that divide people, so do we need an intersectoral approach that recognizes the many links, not only among the health-related MDGs, but also between all of the Millennium Development Goals. If mothers, infants, and children are to be healthy, they need to be adequately nourished. 1/3 of the 9 million deaths of children under the age of 5 every year are linked to undernutrition of the children themselves and of their mothers. We also need to address persistent inequities and discriminatory mindsets that block progress. And we need to end violence against women and ensure the full participation in society. Here too, the evidence is telling. In countries with similar levels of economic development, the higher the social status of women, the lower the maternal mortality. Excellencies, my message to you today is that we can do this. We can reach the targets we have set for ourselves with relatively simple and affordable measures, and by making our health systems stronger, we can prevent the tragic deaths of women and children. We know that success comes when we focus on people, not illnesses, on health, not disease. We know what must be done and what it will cost, and we know that the necessary investments are modest in relation to the vast benefits that will follow. Africa itself is helping to show the way. Over the past 5 years in Rwanda, use of modern contraception has nearly tripled, and skilled birth attendance has increased from less than 40% to more than 50%. In Djibouti, women have organized a community health fund to support healthcare visits during pregnancy and life-saving care during childbirth. Senegal has scaled up community programs for the management of pneumonia in children. Malawi is implementing integrated management of childhood illness at the community level. Tanzania has greatly reduced child deaths through vaccinations, vitamin supplements, and the use of insecticide-treated bed nets and other preventive measures. Uganda has earned worldwide recognition for reducing HIV infection rates, although there is now the challenge of resurgence. Botswana, Ethiopia, Cote d'Ivoire, Kenya, Malawi, Namibia, and Zimbabwe have reduced HIV prevalence in 15 to 24-year-olds by 25%, largely by engaging young people themselves as agents of change. Excellencies, there has also been good progress in improving food and nutrition security, including through the comprehensive Africa Agriculture Development Program. Africa's leaders and the African Union have been integral parts of this picture. This is just the beginning of what is possible with the right policies and international support. Indeed, one of the goals of the